Dr. Price, I'm kind of confused about something.
Confused, Your Honor? What are you confused about exactly?
Can I tell you a story?
Sure.
When I was in college, I played baseball. I think I was a pretty good baseball player. I was all conference, first team. During my senior year, I hit a single, tried to stretch it into a double. I slid into second base, and I hurt my knee really bad. I hurt it so bad to the point where my career was over that year. And as you can probably guess, I didn't get drafted, and I didn't make it to the World Series. I wasn't Mickey Mantle or Willie Mays. But I did have knee surgery for that. And I remember very specifically that before I had the surgery on my knee, the nurse came and prepped me, and she used a marker, and she marked a big red X on my knee that needed to be operated. So there would be no confusion as to which leg needed to be operated on.
Exactly. That is the general procedure, general practice. But unfortunately, the nurse in this case did not do so under these circumstances.
But see, I'm still a little confused because you've operated on her before, correct? So you already amputated 2 toes from her, your left foot? Didn't you notice that the foot that you were operating on had all of its toes?
Your Honor, if I may, that was the 3rd procedure of the day. You can't expect me to remember every little detail about every patient. And I put all my faith in my team, but unfortunately they failed me. Now, Ms. Frazier has already received a generous compensation from the hospital. She's just trying to collect more money and ruin my reputation in the process. This trial is a sham. It's just a blatant money grab attempt by this plaintiff. It's crazy.
Well, Dr. Price, considering all the pain and trauma that you caused this young lady, quite frankly, I don't think that you can put a price on that. Due to your negligence, this young lady here is missing a foot.
Forgive me, Your Honor. But eventually the circulation in that right foot, that right leg, would eventually have been just as bad as the left one. In a couple of years, she would have been in the same position she's in right now.
And that's your opinion?
That is my expert medical diagnosis. It is not opinion. It is a matter of fact.
According to her current doctor, that's not the case. Isn't that true, Ms. Frazier?
That is correct, Your Honor. As a matter of fact, according to my current physician, I have regained complete circulation in both my legs, and I will not have any complications in the future.
Thanks to me.
Thanks to you, this woman here is missing a foot.
Your Honor, I refute the diagnosis from this so-called surgeon. Ms. Frazier's condition was severe and degenerative. A second amputation was inevitable. Plus, Ms. Frazier has not been taking care of herself as she is supposed to be doing. She wasn't taking her medication as prescribed. Her diet was awful. Her diet consisted mostly of soda and dark chocolate.
That is a lie. I took my medication. I followed a healthy diet. I was an athlete before this. As a matter of fact, I was running marathons before you did this to me.
You did this to yourself.
Order in this court. Gosh, I think I've heard enough. Ms. Frazier, before I lay down my judgment, is there anything else you would like to say to this court?
Thank you, Your Honor. This experience has been a nightmare for me. I don't wish this on anyone, not even my worst enemy. While I was under the care of Dr. Price, I followed his directions implicitly. He came highly recommended by my primary care physician, and therefore I trusted him completely. Despite his claims, Your Honor, I took my medications as directed. I did everything he said to ensure that my situation did not worsen. Your Honor, even after he amputated the wrong foot, he showed me no remorse. As a matter of fact, he even joked about it. And I quote, "I will do the next surgery for free." Furthermore, Your Honor, His action hasn't just caused me physical pain, but it's caused